The steps for constructions of single complete denture include first impression, primary and final, and the ideal impression for such a case single complete denture. It should provide maximum extension without muscle impingement, intimate contact with tissue area covered, proper form of border, include the posterior border of the maxillary denture, and the proper relief of hard and sensitive area. As you see here in this picture, this is a case of upper complete denture opposed by lower natural dentition. The primary impression was made from an alginate impression material, then poured with dental stone, and the final impression made with a spaced special tray. And with after that, jaw relation record was obtained and mounted onto the articulators. After that, after trying, checking the occlusal contact between the teeth, upper and lower natural dentition, then this is the final denture ready to be inserted inside the patient's mouth. Recording the intermaxillary relations for single upper denture, freely removing from the upper rim whether the quantity of wax is necessary to achieve the required degree of jaw closure. The incisor levels of the upper front teeth and the occlusal plane can be determined later by reference to the lower natural teeth. This is a trying stage. As you see in this picture, this after correction of the occlusal surfaces of the teeth, this is the correct occlusal plane for the upper complete denture opposed by artificial partial denture and natural dentition. There is an intimate contact between upper and lower teeth equally for all teeth. Setting of teeth and occlusal concept. As we study from previous lectures of subject of occlusion, we have two types of occlusion, either balanced occlusion or monoplane occlusion. In case of single complete denture, the selection of which type of occlusion used in such a case of single complete denture depend on the occlusal anatomy of the opposing teeth. If the opposing teeth anatomic teeth, then a balanced occlusion is used. If the opposing teeth are at rest, then monoplane occlusion is used. This is a case of setting the teeth in balanced occlusion. As you see here, that there is a contact between posterior and anterior teeth in centric occlusion. In the working side, there is a contact between the posterior teeth, and during protrusive, there is a contact between the posterior teeth. I mean that the concept of balanced occlusion was applied. This means there is a contact during centric and eccentric movement of the mandible. There must be a contact between all the teeth, anterior and posterior teeth. I mean the working and non-working side. Upper complete denture opposed by mandibular partial denture. These dentures are very significant. This case is very significant case, and we need to concentrate on these cases of upper complete denture opposed by mandibular denture. Why? Because of there is a complication and teeth selection, which is very important in fabrication of denture. So the selection of teeth based on the following. If the opposing partial denture has porcelain teeth, then porcelain teeth are preferred. If the opposing teeth, natural teeth, have gold or metal crown, when acrylic teeth are prepared. If acrylic teeth are prepared in denture opposing normal natural dentition or partial denture with artificial acrylic teeth. This case of upper complete denture opposed by lower partial denture, mandibular partial denture, has a complication, and these complications include first combination syndrome, second fracture of the denture, third wear of the natural teeth. For the condition of wear of the natural teeth, We have a type of artificial tooth material, either acrylic, porcelain, or metal. And the metal, either it is amalgam or cast. So when we have a natural dentition and we use a porcelain teeth, this lead to attrition of the natural dentition because of the porcelain teeth are a hard teeth. So the solve of this case is by selection of the acrylic type of teeth. But acrylic type of teeth with a natural dentition, with time it will be attrited. There will be an attrition in the occlusal surface of acrylic teeth. So to solve this problem, either use a cast metal over the teeth like present in this picture, but this is an acoustic cast gold over the acrylic teeth. So for the financial resources, they propose to use an amalgam filling in the occlusal surface of acrylic teeth in order to avoid attrition of these acrylic teeth. Occlusal. Metal occlusal surface. In patients with financial resources, gold occlusal surface can be used to minimize the wear of occlusal surface, and in patients with limited financial resource, amalgam stops can be inserted into the cusp tip of the acrylic resin denture teeth. Artificial tooth material. This picture revealed attrition of natural dentition in case the use of a porcelain teeth. So this is the case of porcelain abrasion as a result of use of porcelain teeth in the complete denture opposed by natural dentition.